Hi, everyone. I would like to spend a few minutes with you to introduce you to two lesson plans. And one is on euthanasia and one is on the topic of abortion. And I'm hoping these Zoom presentations are helping you guys gel the ideas together, highlight the key points, and maybe make your workload a little easier. And actually not adding on to it, but really adding hopefully clarification. And let me open this up for you and we'll go ahead and jump in. So I'm going to handle it by covering euthanasia first, and it seems like a lot of notes, but there's only some key concepts that we're going to zero in on, and hopefully today will, be of value to you, so you realize you don't have to memorize. None of this memorization. These are just some quotes here and there and some information, and I'll walk you through it, and then we have abortion. So let's start at the top. And here we go. Okay, so the word itself is a Greek word, and it literally means good death. Eudaimonia, remember that means living well. We learned that as a word from an earlier lesson plan. Eudaimonia is the goal of life, a lot of philosophers said, to live well and to flourish. So this word in Greek starts with the word well, and thanatos. Euthanasia is euthanatos, which is death. So it's how to literally have a good death. Okay, that's what the topic is, to have a good death. There's two forms of euthanasia. There is what's called passive euthanasia, and there's active. So passive is just really in cases where somebody is in pain and suffering, and you're not really intervening, you're not doing anything to prolong their life, you're just kind of letting them naturally die. So that's passive. You're just playing a passive role. You're not giving them medicine, you're not putting them on breathing machines, you're not doing anything to keep them going, but you're also not giving them any medicine to end their life. So that's passive. Active euthanasia is when you try to help their death along, you intervene, it's physician assisted, usually it's possibly through an injection where you're trying to make the death come quickly, painlessly, swiftly, etc. So that's the difference between passive and active. I find it interesting that active euthanasia is now legal in California since June 2016, I believe. Prior to that, it was passive euthanasia. It was kind of allowed, but now there's actually doctor intervention that can happen with active euthanasia in our state. So some basic history here. So we have some philosophers here and some kind of insights of what different thinkers have said about euthanasia and just a few ideas. So Plato's idea is that he supported passive but not active. And the quote is, this is literally his quote, mentally and physically ill persons should be left to death. They do not have the rights to life. So left to death, as long as you're not actually walking in and giving them some kind of medicine or some kind of poison to bring their death along, but you just kind of leave them to die. So physically ill, that's what he's saying, physically or mentally ill. Pythagoras argued, and Pythagoras was a Greek philosopher at that time period, and he basically objects to, he says that, well, I'm sorry, let me start over. His pupils were against suicide and objects to the concept of euthanasia, that it's in the will of the gods, and it's who are we to interfere kind of thing. And then we have what's referred to as a Hippocratic oath, which is the same oath that doctors take today. And it's, I will not administer poison to anyone who asks me to do so, or suggest such a course. And that came from the Greek times, the Hippocratic oath. And that's the objection to euthanasia, not to interfere with the course of nature. In ancient Rome, euthanasia was considered a case of murder. It was not accepted, although it is interesting to note that they would take newborn babies that were very sickly and not long for the world and leave them out in overnight exposure to the elements, and they would die. So yes, overall, there was a rejection of euthanasia, except in cases of that. And Middle Ages of Europe, so Christianity, Judaism, and Islam are all arguing against euthanasia. Then we have a Christian thinker come along, and he is Thomas More, and he is advocating, cases where euthanasia is acceptable. He wrote a book called The Utopia, and he says in cases of extreme suffering and terminal illness that it is understandable, and here is his quote right here to match that. If a disease is not only distressing, but also agonizing without cessation, then the priest and public officials exhort this man to free himself from this bitter life, or else permit others to free him. So that's a quote, and that is coming from kind of a Christian thinker, and that's kind of interesting that there are cases within Christianity that allow for it. Francis Bacon, you might have heard of him. He's the one that's supposed to have codified the concept of the scientific method, and he states, they ought to acquire the skill and bestow the attention, whereas the dying may pass more easily and quietly out of life. So that's in support. So here we have more and Bacon in support. Moving up, I'm not going to go through all of these, just some highlights. So we know that Oregon has always been on the side arguing for the right for euthanasia. They passed a measure in the 90s, and it's called Measure 16. It's called Death with Dignity. There's this case of, what's her name? Brittany Maynard. And she was the woman that was in California. I forgot exactly. It was maybe 10 years ago. And she had developed brain cancer, and she wanted to have the right to die with dignity. She wanted that right to end her life because she was, going to experience incredible pain. She was terminal illness and so forth, and she didn't want to continue on with her life. And so it was not allowed in California at that time. So she went up to Oregon and was a big promoter of the Death with Dignity that's up in Oregon. And moving down here, some other key ideas I wanted to talk for a minute about, because we don't have to go through all of I'm not going to test you on the House of Representatives and how they voted or anything like that, just the key highlights, and I'm doing that with you right now. So this is an interesting story here. Dr. Jack Kevorkian in 1999, he was a doctor who promoted euthanasia and actually would inject patients who were terminally ill and in need of ending their life due to their pain and suffering. And so he's responsible for helping along 130 patients. And in one case, it went to a court case against him for second-degree murder, of which he was sentenced 10 to 25 years. He served 8 years. He died at the age of 83, but some people refer to him as Dr. Death, and this is Dr. Kevorkian right here. Here's a story about him. And if you just wanted to learn more, it's not necessary to open that article because I didn't put any required readings. It's just there if you're interested in learning more about him. Okay, and let's go to the Netherlands, let's mention that. They approved voluntary euthanasia. We'll talk about what that is. And voluntary euthanasia. I mean, I will go through it with you again in a minute, but it's that physician assisted that you are agreeing that you want to be euthanized and you have a doctor come in and help you do that. So the Netherlands, and that's mentioned there. So in Belgium, they also allow for that as well. And this happened all in the 2000-2002 time period. And so if you, what do I have here? Let's click on that for a second. Oh, site cannot be reached. So I'm going to delete that. So let's not worry about that one. So I guess I'm just giving you the source of where I'm getting that information. Where it's legalized, these are different countries. The United States, I'm just going to go right to the US. It is legalized in Oregon, Washington, Montana, and Vermont. And then recently, a few years ago in California on June 9th. And 2 articles that explains in order for it to be implemented, what is required. This is just more saying it's accepted in California now, and this is the article that walks you through what is required. So it's coming down here. Here we have Governor Jerry Brown that worked with us, signed this law into effect. And it talks about what are the requirements. So the person diagnosed must have 6 months or less to live. They have to have 2 requests that they make, and they have to have, this is a written request, you have to have witnesses to it, and one of whom may not be relative, okay? Because they don't want that idea that the relative's pushing you to be euthanized to kind of have the burden off the family or the financial burden off the family. The physician the attending physician must determine that the patient is mentally competent, that they're making a rational, informed decision, and it has to be more than 1 doctor. It has to be, I think it's 2 doctors. Let me see. Yeah, second physician must confirm the diagnosis, the prognosis, and the mental capacity of that individual. So that was kind of interesting to learn about that. And let's move here. So we're on the types of euthanasia. There are 3 types, and I'll walk you through each: voluntary, involuntary, and non-voluntary. Voluntary is what you're probably most familiar with, and that's that whole idea that somebody has terminal illness, they are willingly wanting to die because They are in pain and suffering, and they asking for the help of the medical profession. They're asking for a doctor to step in and assist their suicide. And in some places in the world, that is legal. And involuntary is a very rare. We're not going to really run across involuntary, so I won't spend much time on it. But it's cases where it's very rare cases where it may be like a situation that a horrible death awaits somebody, so you take their life before they have to go through that extreme, painful, unbearable death. So that's kind of involuntary. They don't want to be killed, but you're doing it out of a kind of a mercy killing, so to speak. So we're really not going to focus on that, because the main areas that you're going to run into is voluntary and non-voluntary. Non-voluntary, you think, well, why would you have euthanasia if it's not voluntary? The person's not wanting it. It's not that they don't want it. They just never voiced their preference for it. They may be cases where they've lost consciousness. They're in a state of coma. They're severely disabled. They're, maybe possible dire pain, but or unable to communicate, let's say, incurable cases of diseases, and they're also in a state where they may not have the mental capacity to express what they want, and so they're not able to communicate that. And so non-voluntary is you're taking it upon yourself to make that decision for them. So voluntary, you're choosing, asking for the help of the doctor. Non-voluntary is cases where the medical profession steps in, looks at the person, says there's no possibility of this person being brought back to health, and there's no possibility of this person getting out of this horrible situation. It's incurable. There's a life of misery, and they kind of consent with the family what they want to do. Okay, so I'll look at each. So let's see here. The non-voluntary is not just cases of people in comas, not just cases of people who are elderly. It also could be cases where infants, that would be certainly non-voluntary, because an infant doesn't have the ability to express and the ability to say, hey, I want to continue on. So non-voluntary euthanasia would apply here when the parents then would have to make that decision. For instance, imagine you had a baby that's born with severe intellectual disability, or a baby that's born with spinal bifida, which is lacking a spinal cord, or a baby's just born, I guess there's cases, spinal bifida, I think you're also missing part of your brain, not just the spinal cord. So, there's just horrific situations, and non-voluntary euthanasia would be cases where the parents then want to have the right to not prolong the life of their child. And Peter Singer is mentioned, I think this is his quote here, saying, he thinks that in those extreme cases, it should not be in the hands of the state to decide. It shouldn't be in the hands of the medical profession. It really should be the hands of the parents to make those decisions. And the parents should be able to be empowered, because it's their child, and they're the ones that love that child and can make the best decision for its situation. So what do I have here? What are cases about severe accident? Okay, this is a very strange one. So cases where people are biologically alive but not biographically. So just to share my little story here, my father fell off a ladder, and he was in exactly that case. He was biologically alive but not biographically. There was no more brain state, definitely in a coma, vegetative, elderly man. And they said, you have two choices. It's kind of interesting one. I'll give you my personal account here. You have two choices. You have choice number one, put him on this feeding tube, completely vegetative, and I say in a miserable state, even though he may not be consciously there, but just a miserable, non-biographical existence. Or we can engage in passive euthanasia, and that is just, unplug everything and just let him pass on his own. And at that time, they didn't have active euthanasia, because this was 1 year before 2016. So family had to make a decision. Do we keep him biologically alive, but there's no person there anymore? Or do we just, stop everything? So we consulted his will, and his will clearly said, do not resuscitate, very clearly in this context, in a coma, brain dead, blah, blah, blah. It was clearly explained out what he wanted. And so that's what we went with. But the fact that it wasn't active euthanasia, it wasn't, it was voluntary, certainly, but it wasn't active. It was kind of a tough one, because it would have been so much easier to give him some kind of medicine to help it along. It ended up to be a very prolonged, 24 hours of torturous gasping for air. So I'm just sharing that with you, that even though passive sounds, oh, that's kind of nice, just let them alone and let them pass on their own, it's not necessarily, from one perspective, the humane thing to do, because you really have to confront the fact that somebody is possibly truly suffering in that state, and a little medicine, knowing that they're going to die within 24 hours anyway, could speed it up. And you know, it's almost like put the tortured animal out of its misery in that sense. It was a very horrific 24 hours for our family. Okay, so moving along, that was years ago, so I'm talking about very objectively now. Voluntary euthanasia. Okay, voluntary euthanasia, what I want to say here, again, some quotes from Peter Singer, because we're pulling from his article, and he is in support of it in this case, and he raises opponents' objections here and talks about it in this quote here. He talks about how in the courts in Netherlands, it's deeply, supported, voluntary euthanasia. It's not a problem there. It's a problem across a lot of the states of the United States, not all of them, as I mentioned, but certain countries it's acceptable. And these are the qualifications for voluntary. It has to be by a physician. It has to be, there's no doubt the patient is requesting it, and they're well informed, and they're free thinking, they're using their reason, and all of this. So those qualifications there. Okay, involuntary euthanasia, I had just gotten through saying it's very rare, very abnormal situations. So if this is from Peter Singer, if in real life we are very unlikely to encounter cases of justifiable involuntary euthanasia, where you're going to go in and kill somebody so they don't have a, extra horrible death, the next week or something. So that would be very, very rare. Now, some people object to this whole concept of euthanasia, saying, well, if we're going to allow for euthanasia, isn't the next thing we're going to allow for genocide? And Peter Singer addresses that, saying that's kind of a false comparison, and it's kind of a slippery slope argument to say just because we're trying to lessen the pain and suffering in the euthanasia case doesn't mean we're going to downright go out and full on commits genocide of mass people. So he's just clarifying that would be a faulty way of thinking. Now, so hopefully I've introduced you, I've made the key points here, and I'll move to abortion in a minute, but the key points here is to understand the difference between active and passive, to understand that in history it's been a debated topic, supported by some philosophers, not supported by others, not supported by some religious thinkers, supported by other religious thinkers and philosophers. So it's just, we have a lot of voices expressing their ideas there. We have the 20th century material here. Death with Dignity is a big one, and Kevorkian's a big one, okay? And then we talk about the 21st century, and that it is legal in the US as of 2016. I'm sorry, in California as of 2016. We talk about the different types of euthanasia, and the key ones is voluntary and non-voluntary, and hopefully that added a lot of clarity. Okay, and a lot of those notes are just filled with quotes, so don't read them, but don't worry about stressing on them for the test, because it's not about that. Okay, the abortion material here. So abortion's another topic under bioethics, and it is also a hotly debated topic. Definitely, people are going to have strong opinions. When it comes to euthanasia, I haven't noticed as strong opinions. Like, a lot of people aren't as uncomfortable with it. I've noticed from my students, comfortability with euthanasia. When it comes to abortion, it's a split class, absolutely, because there's very strong opinions here. I noticed a tendency towards, it's the right of the mother, but not always. I'd say about 30 to 40% are strongly against abortion. Three classic positions: abortion is always wrong. Abortion is the right of the mother, especially if it's her life at risk, but irregardless, it's the right of the mother. And then this one, well, in some cases, it's a range of circumstances. Sometimes it's acceptable, and sometimes it's not, depending upon the context. And the three positions here. So I have three tiny, short little blurbs for you to read, representing those three sides. One is from a Catholic archbishop, and it's like the womb to tomb argument, and that's just, we have no right to interfere. The life occurs at the moment of conception in the womb, and it's no one's place to interfere until one gets to the tomb, kind of thing. It's all in the will and hands of God, so to speak. Now, this woman, her Susie Allison, she's pro-choice. She represents that classic women's rights. that it's the woman's right if it's her body kind of thing. She points out that 95% occur within the first 3 months of gestation. So we're not talking about late-term abortions, which are a lot more problematic. And then we have Peter Singer on this, and he gives an alternative and kind of fits the third category here. And his is the CNS argument, which is the central nervous system argument. And it's really arguing that, I mean, I think you're going to say between Susie's and Allison's and the Archbishop's position, he's going to fit more with Allison's position, but he's going to ground it on the central nervous system. He says, once the fetus has developed the capacity to experience pain and has a developed brain and a developed spinal cord and a developed central nervous system, that's the point of which we should say, hey, maybe we should rethink that abortion. I can't say he's downright against it at all, because he's definitely for overall the right of the female making that decision, but he says the central nervous system needs to be considered. So if you are going to have abortion, make sure you do it before there is no developed central nervous system. And when is that central nervous system? When is that cutoff? And Singer places it at 18 weeks, but to be truly comfortable, a lot of people say, no, that's even a little too late. Let's bring it earlier than that. But that would be the absolute cutoff. I know that when I had an ultrasound, they make sure that ultrasound is done by, they want it about 18 weeks. They don't want it to go into 20 weeks. I think 20 is the absolute latest they'll do that ultrasound. And I'm sorry, not ultrasound. They'll do the ultrasound for the whole pregnancy. I'm using the wrong word. I'm talking about when they stick the needle in and pull out the amniotic fluid. And when they do that test, the reason why they don't do it past 20 weeks is if they find out there's a problem with the child, and the mother's like having that decision, they don't want that mother to abort after the 20 weeks, because that is when the central nervous system's there. And that's kind of the concept of we have a really fully developed central nervous system. And so it'd be best to make those decisions much earlier. And so they want to push for that to be done earlier in the pregnancy. About 18 weeks to no longer than 20 weeks is the latest. So, okay, I don't think they have to do that long needle in the womb anymore. Now they do blood tests and other things. So it almost seems a little archaic that they used to do that. And it was not a fun experience, I can tell you. Okay, and my babies are fine and they're healthy and everything was wonderful. Okay, so arguments against abortion, it's the classic one. It's a syllogism, killing innocent people is wrong, and a fetus is an innocent person, and therefore abortion is wrong. And didn't we run into that same kind of syllogism in our last lesson plan? And I believe we did some very similar one. And with that whole concept of embryonic stem cell research, and then also killing potential people is wrong. I've heard that before. Killing somebody that has a future is wrong. Causing pain is wrong. There's these various arguments against abortion. And then arguments, not so much, it sounds like people are in favor of abortion. That's worded poorly. It's not in favor of abortion, but the right to choose if one wanted to. So that should be clarified. So the fetus is not necessarily a person with a right to life, is the argument some people make. It's not always wrong to end the life in cases of disabilities. That's why they do the embryonic test where they stick the needle in at a certain age, because they want the mother to be well informed, and in case there are disabilities. The potential human beings don't have rights, but actual people do. So some people have argued that it's not the one that's potentially going to be a human, it's the actual person that does. And then the pregnant woman has rights too. So those are some ideas there. So going down here, there are some philosophers like Plato and Aristotle. Well, I have here, the New Testament doesn't really discuss it, but the Hebrew Scriptures talks about like the pregnant woman, the child's kind of the property of the mother. So that's kind of an interesting take on it. Greco-Roman times, Plato and Aristotle, they allow for abortion, okay? They weren't in cases, especially in cases of disability, and a lot of conversation occurs a lot of discussion occurs about quickening. What is quickening? Quickening is when that little, the embryo is now the fetus, and the fetus is now 17 weeks, and then the mother starts to feel like little butterflies in her stomach, and that's the baby starting to move around. And I remember it was like clockwork. I think I felt quickening around the end of my 15th week. And that's just little tiny little things you start feeling in there. And then pretty soon by the 39th week or 36th week, you get full on punches and kicks. But that quickening, and they call it animation or quickening, and so you start feeling it. And so some of the philosophers here, like Aristotle, he doesn't have a problem with abortion as long as it's done. He says that the male embryo at 40 days and the female at 90 days, as long as it's done before 40 days, he thought the soul entered into the males earlier than the females. That's kind of interesting. Aristotle had a little misogynistic idea, so I won't go into that right now. And then we have Christian thinkers, and this is really interesting. So some of them argued it was murder, and I mentioned Clement of Alexandria and Tertullian. But then you have, and these are very famous Christian philosophers / thinkers, Augustine and Aquinas. And this is shocking for a lot of you. Augustine was highly influenced by Aristotle. And Aristotle, I had just said, doesn't have a problem with it as long as it's done early in the pregnancy. And that's what Augustine says, as long as it's done before quickening, before there's animation or before it's animated. And I put, wow, how amazing. Because that is, you always think, oh, the Catholic Church is highly against it. But if you go back into some of the writings way back before the 6th century, back in the 4th century, you'll have kind of conversation by Augustine that accepts it in some cases and accepts it as long as it's done before quickening. And then you actually have Aquinas who holds that position as well, as long as it's done before animation or quickening. But I said the 6th century, I meant the 16th century. So the 16th century to the 20th century, absolutely unacceptable. So it was not accepted for those like 4 centuries there. And here's a quote that, the Catholic Church truly condemns it. But it's so fascinating is the word, that there is some history of early Catholicism that allowed for it. Now, England also says it has to be done before quickening, and they have their rules, which are very different than the United States. The United States, in 1973, we talk about Roe versus Wade, and Roe versus Wade is when we allow the women to choose, and that was pretty late, where we had it much earlier in England, I believe, is what the argument I was making is. So actually, I don't know when it was illegal in England, so let's not worry about that. But the United States was 1973, and there is some people today arguing to challenge Roe versus Wade, and that's where you get the 2 different sides of the argument, and that's what we're discussing in here. I'm not holding a position, I'm just presenting different viewpoints and the history behind it. And then the medical topics, this is all found in the BBC article, and it just talks about, for instance, the methods that people used for abortion. There's the abortion pill, which you have to take within the first 7 weeks. There's the morning after. And the morning after is really something that I want to look at for just a second. It has to be taken within 72 hours after sex, and there is no implantation. So it's really not an abortion, it's a prevention of a pregnancy. So that's something different. And then there's actual surgery. And there's a lot more information here. We have, what else do I want to say here? Is anything else here? This is all covered, like the rights of the mother, the rights of the father, the rights of the unborn child. So different conversations that are found in those BBC links there. And then I want to click on this just for a second. I think I'm running out of time. I didn't even look at the clock when I started, so I don't know how long I've been talking. The legality of abortion worldwide. If you look at these categories, 0 is abortion's not allowed. 1 is it's only allowed to save the life of the mother. 2, it's again allowed to save the life of the mother. And this one is to save the life of the mother, or in other certain situations, maybe the woman was been raped. And then abortion is allowed, and it's the right for the mother to choose that. So here are the different categories, and then here you have the different countries. And I just thought it was something you might be interested in. You're not going to be tested on this. You're not going to say, well, what is Poland's position? What is Ireland's position? But if you just wanted to know, and I'm looking at the zeros, where it's absolutely not allowed. And then the ones that are 4s that it is allowed. So we have like, all of Europe here, Belgium, France, Germany, Luxembourg, Netherlands, Switzerland, Austria, etc. So, and Ireland. Now, Ireland's very Catholic. So what did they say? What's number 2 again? Number 2 is explicitly to save the life of the mother. So, and this website was 2013, and now it's 7 years later. So how accurate is that? I believe it's fairly accurate, and I could check that for you, but it's more just a feeler for you to understand, you know, the different positions around the world vary so radically. So I think that's it. I have reading here for you on the 2 bioethic topics, required films, and then your post question. So I won't click onto those because I've already utilized so much of your time, and I thank you for watching. And if you have any questions, I have a help forum, I have email, I'm here for you at any times. I can't answer whether you should have an abortion or not, or whether you should put in your will to have be euthanized, active euthanasia, but I certainly can here to answer any academic material for you. Okay, thank you for watching, and I'm going to click out.